The new guidelines, the goal blood pressure would be less than 130 systolic, preferably less than 120. In between 120 to 130 is kind of labeled as pre-hypertensive now. So the goal would be less than 130 and then less than 80 on the bottom number, which is called the diastolic. So, if consistently greater than 130 over 80, I would contact your physician regarding tighter blood pressure management with your medications. And even though hypertension or high blood pressure is a fairly asymptomatic disease and you don't really know, it's still very important to keep that controlled. Again, in patients that have heart disease, it can make heart blockages worse or could cause strokes, other things that people don't realize. There's new studies that shows that it can actually worsen or even give early onset dementia. So it's very important to keep the blood pressure controlled. Good tips would be to check your blood pressure at different times of the day. You don't always want to check your blood pressure at the same time, on the same day before your medicines, or after your medicines even. It needs to be at various times. I mean, it's normal for your blood pressure to fluctuate. And, we would advise, another tip would be to check it at least once a day, and preferably twice a day in most of our patients, to make sure that we're keeping tight control with that blood pressure. It is obviously very important that you have a home blood pressure monitoring cuff, and we would advise that you have an arm cuff and not the one that goes on the wrist. The one on the arm is a little bit more accurate than the wrist cuff. We would advise to, when you do check your blood pressure, that you write it down on a blood pressure log and keep note of this so that when you do go to the physician, their office, they can look over the entire log and see how your blood pressure fluctuates throughout the day.